As you mentioned, this Sunday is Mother's Day, which in addition to providing a day of reverence and reflection upon the lives of all of our mothers, is also one of the most important days of the year for Rhode Island restaurants. And because of the actions of the federal government, and quite frankly, the inaction of the state of Rhode Island, restaurants and retail businesses across the state will be unable to properly serve their customers. House Bill 6249, championed by state government, rather than addresses the underemployment crisis, further complicates it by using incentives to encourage employees to work a sub-10-hour work week. House Bill 6218, carefully crafted by members of the state's business community, creates an incentive to a full-time return to work, bonus workers, and is arguably resident positive to the state. In a state where highly compensated patronage jobs are freely available...
I got it, Pat. So,
well,
let me answer this, okay? I'll be happy to answer it, actually prepared to answer this, because I was expecting it to come from somebody about this issue, about the problem that we're having and businesses are having in terms of employment, and it's an absolute priority. As I mentioned a few weeks ago, legislation is on the floor, I think, of the Senate, that we believe is going to be helpful to bring people out of the workforce. We'll be setting May 23rd as the date to require a work search in the state of Rhode Island, and believing that both the House and Senate have indicated that they're going to pass legislation that is going to be set up in a way that, again, we're going to use Washington's money. They set the problem up. We're going to use their money to help us offset this issue. We've been researching around the country. Rhode Island is leading the issue around the country in terms of the issue. I'm not going to do what Montana did, which was to stop people from having the ability to collect the $300, 68,000 people to be able to collect the $300. In fact, I'm going to be encouraging more people if we can create an incentive to get people the $300 and provide the workforce that we need to open up after Memorial Day. So that's really good news right now. We're going to continue to do the research to make sure that we're providing whatever we need to make sure that people understand it's time to get back to work, it's safe, and we're going to do whatever we need to make that happen, including we're very hopeful and thankful that the General Assembly is taking this as serious as we are and passing that legislation. I don't think it's going to be the only thing that we're going to do, but we're going to continue to do more. And when the new round of stimulus money comes, and that's what I'll be talking about at 2 o'clock in terms of what is Rhode Island going to look like in 2030, there will be a bucket for economic recovery out of those dollars, and we're going to use those dollars to help these small businesses in any way we can to make sure that they survive, and then after the pandemic continue to thrive. Thank you.
Rob, Anita?
Of course, yesterday Secretary Raimondo suggested that it may be child care and then people who are concerned about getting the virus or spreading the virus as part of the problem as well. Anything on the table to address those two aspects of the employment?
I think she's talking nationally, because she's not talking here. We just mentioned that 90% of our teachers and related staff has been vaccinated. I don't know whether other states have done that, but I know we've done that well. Child care, in addition, has been vaccinated at that same level, and all the related workers. So when we do this, require this work search that's on May 23rd, that's going to open up people to get out in the workforce. They're going to use the child care and our schools. So, of course, the safety issue is a top priority, has been a top priority, but as we approach the vaccination rates that we're approaching, that should not be an issue. And as far as the child care goes, we're opening the child cares to full capacity, by that Memorial Day weekend, if we already haven't done that. So I'm not exactly sure where those are. But, yeah, Secretary Raimondo must have been talking about other areas of the country that she represents, not the state of Rhode Island.
Rob, Anita, Amanda, Brian.
Mr. McCarthy, last week Massachusetts announced that 99% of people who got the first Pfizer or Moderna shot were coming back for their second shot. Do you know how many people in Rhode Island getting a first shot of Pfizer or Moderna are coming back for their second shot?
I do. Right now, we've seen about 95, 96% have been returning for the second shot, which is great. We want to get to 100, but seen a really strong return for the second dose in Rhode Island.
Amanda?
Are you seeing more people take advantage of the walk-ups rather than appointments now, and do you have a rough percentage of that?
We have. So just last week, Thursday to Saturday, we had 2,500 people walk up for their first dose between the Dunkin' Donuts Center and Sauconasset. So part of, as we continuously reassess our infrastructure, where our clinics are. What we've seen is that central location in Providence and in vicinity of the commercial district in Cranston, we've seen quite a few people walk up.
Brian Hummel John.
Is there any concern that the federal government will reduce Rhode Island's vaccine supply as more and more appointments remain open?
There isn't. We still remain above the average for administration, and a big thing to consider there too is, we've received an additional 150,000 vaccines because of our performance previously, which did a couple of things for us. One, it allowed us to identify that we needed to make this transition to a third phase as we'd kind of exhausted some of that immediate demand. But what the federal government has actually done this week is they provided additional flexibility for states to order additional doses as they kind of manage the demand across the country. So I'm confident we'll continue to get all the vaccine we need.
I had asked the governor the other day about incentives to get people vaccinated, gift cards to things or something like that. More and more places are doing that. What do you think, Tom, about, is that something that works, or is this, if you don't want to get it, those people aren't going to be convinced, and is that really an option?
Yeah, that's something we're exploring, and I think, you'll see some continual partnerships. We had a great event with the Providence Bruins last weekend. So there's a couple of things that it does. One is it keeps it top of mind. Again, our public health metrics are going to continue to trend in the right direction, but we still have to take an action. So we don't want people to forget about this over the summer. The other piece, to your point, though, is what's going to be meaningful for people. And for some, incentives will be. We want to make sure that it's based in research, and that's the work that we're doing now. The other is, who is going to change someone's mind that right now is not willing? And what we found is, that's that trusted healthcare provider. So a big part of this strategy is how we begin to enable primary care physicians and pediatricians to administer these doses. The big thing we've got away there has been, each of these comes in a vial with 6 to 14 doses. So just making sure that we're being efficient and getting updated waste guidance out to our providers, which we're expecting from the CDC within the next week.
Governor, do you want to add?
Well, I don't know if we're going to do the beers and shots, but wouldn't it be good? Dell's Lemonade would be Dell's Lemonade would be pretty good, I think. Especially out there. I can envision one of the portable stands outside of our clinics. Maybe that'll happen.
Dr. Chan, good afternoon. Just two questions. At what point, what percentage of the new cases you're seeing are from the variants?
So at this time, I also don't know, Tom, if you have some updated numbers. We're seeing a significant subset due to variants like B117, and the data shows that it's about 50% more infectious, and there's a question about whether or not it can cause more complications like death.
50% of the cases you're seeing are from the variants?
Do you have the...
Yeah, the way I would think about it is with our public health surveillance, we can't sequence every single positive test. But knowing that B117 outcompetes the strain that had been here previously in other variants, it's safe to assume that the dominant strain here, the vast majority of cases, are from B117. So that's why we've also seen, even though we've had a very strong vaccine program for a little while a few weeks ago, our case rates plateaued.
And Dr. Chan, what numbers are you seeing of people who have been vaccinated that are getting COVID?
So based on a lot of data that's coming out, we believe that the vaccines are about 90% effective in preventing infection. A lot of the earlier conversation a few months ago was about 100% preventing severe disease. We know these vaccines are really good. 90% preventing infection is really one of the best case scenarios. But again, to that point, it's not 100%, and that's why we need to get as many people vaccinated as possible. There's still some concern, for example, in immunocompromised people that have immune systems which may not mount a response.
John Anita.
Dr. Chan, my question comes from one of the listeners, Nancy from Lincoln. When will nursing home residents be allowed to leave the facility with their families again?
Yeah, it's a great question. I'll say hi to Nancy from Lincoln. I also live in Lincoln. The answer is it's a moving target. So I would expect a decision on that probably in the near future. I know it's being discussed. Obviously, longer-term care congregate settings have been one of the most hardest hit settings. And, we were seeing the majority of deaths in the past from those settings. So we want to be cautious. And it is one of those settings where we're kind of the last to let some of these restrictions go, but we're actively discussing. It's a good point. We're also taking into account, of course, social isolation, mental health of the residents, which is obviously an important thing.
Families that are going to go visit, it'll probably come up. What would be your advice for them to tell the resident, you know, hang in there? Are we talking Memorial Day, July 4th? I'm not trying to hold you, but someone going, I think it would help if they knew when the light at the end of the tunnel was going to be put on.
Yeah, it's tough to give an exact answer to that. I would say probably weeks. We are, again, in a good place, 1.1% positivity yesterday. Everything's trending in the right direction. So I would say in the near future, it's something that we're taking a close look at.
Would you agree there seems to be confusion with people who are vaccinated and then wearing a mask outside? I mean, the President Biden has come under, fire a little bit for that, or just people questioning. You saw the Vice President before she came to Rhode Island yesterday. She was vaccinated, her husband's vaccinated, and they have masks on kissing each other at Andrews Air Force Base. What would you advise people who are vaccinated, who are outside, on what the safety is, or what you would advise them?
Yeah, it's a great question. So I'm fully vaccinated. I am at very low risk from complications from COVID. So one of the reasons why I wear a mask is to protect others around me, right? So these vaccines are very effective, but they're still not 100%. And I don't want to take the chance to my patients, to my family, to older adults around me, that there's even a remote possibility that I could transmit to others. That's one thing that we don't know quite yet, is whether or not someone who's vaccinated, who has the infection, what's the data on transmitting to other people? We don't have data on that. There is still a potential that it could happen, and so one of the reasons, at least, why I wear a mask is to decrease that chance even further, protect even on the off chance of transmitting to another person.
Children with summer camps, Dr. Chan, is that really necessary that 5, 6-year-olds need to be wearing masks in summer camp? It just doesn't seem to resonate with the public.
Yep. I mean, I have a 10-year-old who's going to be going to summer camp. The restrictions that we talk about up here, again, are the very basics. There's still a lot of things that we just don't know about this pandemic. That's been really a theme as we've all sat here week after week. We're learning week after week. There's a lot of things we just don't have a lot of good data. It makes sense, again, for masks. We're working with the summer camps, other organizations to look at guidelines like masking, like testing, et cetera. So I know that there's not a lot of easy answers. We're working on it. But I do want to reassure people, of course, that I do feel like we're almost there. We are almost there. So bear with us a little bit longer. Everything we're talking about, if people listen and follow through on some of this, we should be, again, over this before we know it.
Dr. Chan or the governor, whoever can best answer this, I have a question regarding high school clinics. We got some data from Cranston schools. They say about 130 students from each high school got the vaccination who were eligible. They were expecting about 1,000. It seems like a low turnout. What are your thoughts on that, and how are other high school clinics going as they start?
Well, I'll let the doctor speak to the reason why we're doing it in terms of safety, but we're going to go anywhere where we can get 100 shots. So we're happy to get the 100 shots. I also mentioned, give a shout out to the city of Pawtucket, who's going to be running a kind of an outdoor event for the kids that are getting vaccinated, and I think that's a great idea as well. So we're going to do everything we can to make sure that people know that they need to get vaccinated. But if they got a couple hundred people, 130 in each high school, that's 250 people in the city of Cranston. That's worth us going out and doing, and then can keep on encouraging the students to respond in a way that has been laid out here to get people vaccinated.
Were you expecting more, or is that sort of what you were anticipating?
No, I think, and this speaks to the shift in the strategy at this point, as the governor shared. If there's an opportunity to go vaccinate 100 people in one location, we'll take it. So we recognize, this isn't our only pass with Rhode Islanders high school age. We'll start with those that are willing, they're comfortable, they're ready to get the vaccine, and we'll provide them that opportunity. And then we'll continue to encourage the right dialogue. We'll continue to enable primary care physicians, to have those conversations and provide the vaccine. So we're also looking ahead. We may see an emergency use authorization in just the next couple of weeks here for 12 to 15-year-olds in Rhode Island, and we're looking to follow a similar model. Those that are ready, we'll come to you. We'll have a site, and we'll vaccinate as many as we can as quickly as we can, because that speed is still important. And then for everyone else, we're going to continue the dialogue and continue to offer you an opportunity.
We're going to take 3 more so the governor can get to his community conversation. Wayne, Plampkin, Alexa.
Tom, can you elaborate on what you mean by making COVID a manageable disease by the fall? A little more specific of what that, you compared it to the flu?
Yeah, as we continue to learn more about what's next with COVID, we have a few examples internationally. The furthest ahead with regards to the vaccination program nationally is probably Israel, with the United States, shortly behind. One of the things as we're looking at what the future probably holds is going into next year is making sure that we can effectively manage the disease. So limit disruption, impact to our daily lives, ensure that we're fully open, but it's still going to be a consideration, because one of the largest challenges we have is that even though we have a very successful vaccination program in Rhode Island and the Northeast, it differs across the country. And then when you look globally, it's an even bigger challenge. So it's very encouraging to see, the leadership role that we nationally are taking there to be supportive. But what we have to consider is, in a country like India where there's 400,000 new cases a day, that is where it's ripe for new variants and new mutations, to emerge. So even though we're in a great spot now, in order to stay in a great spot, we need to maintain that robust public health surveillance and that engagement, with our healthcare professionals here. But we are confident we can do that. The state can fully open safely, and we can manage this just like we do other infectious diseases.
Steve, Alexa.
Mr. McCarthy, you've given us a number, 13,500 or so people 75 or older. Have you identified those people? How are you going to identify them? Can they expect a phone call from you? And beyond that, can you foresee a time when you're going to drop that figure down to 65 plus or 35 plus?
Absolutely. Absolutely. We're going to keep adjusting to find what works and continue to improve upon what we do each week. So right now, obviously, we're prioritizing that group because, as Dr. Chan shared, if you're 65 and over in Rhode Island, there's a 50-50 chance that if you contract it, you're going to be hospitalized. So we want to prioritize those most at risk. With regards to their information, fortunately, we've had such a strong engagement in Rhode Island and a strong testing program. We have many of these Rhode Islanders' contact information already. And then we're, also looking at other ways to make sure that we can engage with all of them. But that's the expectation, is we're going to reach out, provide that personal touch to all of these Rhode Islanders. Absolutely.
Alexa, last question.
Yeah, I want to piggyback off of that. When is that phone call happening? Why haven't these people received a shot yet? And who's actually administering them? Is it going to be privatized, or is it going to be through the state? How is that going to happen?
Yeah, we're going to start with, we've had several vendors that have been supporting us with our homebound vaccination program. That's already going, ready to go. We're hoping to begin making the phone calls end of this week and begin going out to start conducting vaccinations next week.